Hello, and welcome to the Science of Skin podcast. My name is Dr. Ted Lain. I'm a board-certified dermatologist, and I am here with my partner in crime, Dr. Patti Farris. How you doing, Dr. Farris?
I'm good, Ted. How are you?
I'm doing wonderfully. It is middle of January, and we decided that we would record a podcast episode about trends for 2026. But Patti, you decided to twist that a little bit because why not? And
Why
you want
not?
to talk about things from 2025 that you want to see kind of go by the wayside.
Exactly. Let's put this stuff in the rearview mirror, guys. There some of these trends that are coming out of social media and other places. I think we have to start with like our most hated ingredient, which is beef tallow. I don't know how many times we can talk about beef tallow and tell people that it's not an appropriate moisturizer to put on your skin, but that's one I want to see go away. Even things like glass skin, which is layering moisturizer on top of moisturizer so your skin looks wet. Like, I'm just not sure about the wisdom of that. And I don't think any dermatologist would say it's necessary. And there's so many good moisturizers, like just pick a good one and go with it. I also think these complicated regimens that have been promoted on social media are really, we got to get rid of that. People are layering too many actives, too many acids on top of each other, getting irritation. So I would say this year, let's go out with the complicated and in with the curated, in with the carefully selected ingredients and carefully selected products.
Wait a second. I just need to trademark that. Out with the complicated,
out
in
with the
curated.
In with the
curated. Email sent to the trademark attorney.
Sent that to our trademark attorney.
I like that.
But I think one thing, everybody's so focused on AI right now, and we know AI can do a lot of this, but don't bypass the dermatologist. Don't underestimate how a good skincare consultation, I think that's always been one of my favorite things to do, is just talk to patients about skincare. There's so much that goes into it, your lifestyle, your sports that you play, your profession. There's just so many things that go into what you or I might choose for a patient that I know AI is going to be really good at it, and we're seeing a lot of that. But I also think that input and discussion with patients and consideration with pre-existing conditions, all the things we talk about.
Yeah. It's funny that I'm so lost as to whether now we're in the era of complicated regimens or we're in the era of like 1 or 2 step regimens. I feel like we seesaw back and forth depending on the season, but I totally agree. Yeah. Can we be rid of the 19-step essences and lotions and potions and, triple cleansing and just keep it simple, especially in the era that we are in where we have these amazing new ingredients in products. We used to think about products being kind of Swiss Army knife products because they included 13 different ingredients, each of which did a different thing. And somehow they were formulated to be stable, we hoped. And now what we're finding, especially with these regenerative ingredients, is, you focus on one of the hallmarks of aging, let's say autophagy or RNA snipping or slicing, or you focus on mTOR, for example, and you're able to really fix so many of the clinical issues that we have with photoaging, so that the Swiss Army knife is one ingredient instead of a 19 ingredient formulation, which makes it so much easier to use.
Right. Too. So another one of my out with the term anti-aging and in with the term regenerating. And I think, you just hit on it, bringing in fixing skin at a cellular level, looking at those hallmarks of aging type of ingredients that we're seeing now get so popular. The peptides, the growth factors, the exosomes, all these regenerative technologies that address skin aging at a cellular level. And rather than trying to fix the problems, let's prevent the problems. I think it's bringing younger consumers and younger patients into the conversation too. The whole notion of preventative skincare, which is really what we're doing with these regenerative technologies.
It's hard to kind of, if I were a consumer, I'd really be a little confused right now, because when you hear regenerative or longevity ingredients, you think, okay, so they're helping me stay the way I am and not get worse. But what about reversing the damage that's already done? And that does happen, guys.
Oh,
So
yeah.
with the regenerative ingredients that we're focusing on, as I mentioned, the hallmarks of aging are a lot of the targets, and we know those are reversible. Otherwise, they wouldn't be considered a hallmark. To be a hallmark of aging, it has to be reversible. And so by targeting those, we do see a reversal of some of the damage that's already been done. So not only are you, fixing damage, but you're also preventing and slowing the aging process. So if we think about aging as a disease, that's kind of what we're doing. We're treating it like that. And certainly, skincare has jumped into structure and function. I just don't think anybody can argue about that.
No question. I think we're really seeing like a 180 change in the paradigm about
Mhm.
the way companies are approaching it. Look at all the companies, Ted, that we work with and that we're, close to, that are coming up with these really interesting plays
Mhm.
in the regenerative space and in the longevity space. So skin longevity is definitely here to stay.
I mean, we had a conversation today with a company, and it struck
So
me so
interesting.
interesting, right? It struck me that the claims that these companies make are kind of unfortunate. They're so limited as to the claims they're able to make as OTC skincare, but what the actual activity of the molecules is so scientifically incredible that the claims kind of, I don't know, bludgeon the science in some
Yeah,
ways.
they pale by comparison to what it's
Yeah,
actually doing
right.
because they
Yeah.
can't make those claims.
Mhm.
So it's almost like handcuffing the
Mhm.
companies in a lot of ways. And I understand why they walk the fine line. They don't want to get any eyebrows raised on their product. That's
Mhm.
for sure. But boy, yeah, that was a super interesting. I mean, that's another thing we're going to see some really good innovation in this year is, that we were talking about sun protection. And we're hoping that the new filter, is it
Bempt. Mm,
bemotriazolinol? I
But
never can
I
pronounce it
just call
right.
it Bempt.
Bempt.
Yeah.
Oh, I like
Yeah.
that. Okay. So I can remember that. I want to say that scientific name.
I
I
know.
am a doctor, for gosh sake, but I can't remember it. So
Yeah.
BEMT I think, is going to get approval this year. 2026 is supposed to be their year. And that's a totally different, very interesting and excellent UVA long wave filter.
I'm
It's going
so
to
excited
change.
about that.
Yeah, it's going to change a lot, especially for our patients with skin of color and hyperpigmentation, right?
Mhm.
Where UVA protection is super important.
Mhm. Yep. So we're going to see advancements in sunscreen filters. Hopefully, now I can
Yes.
stop telling my patients to travel over, to different countries to buy sunscreen.
Yeah.
And
And we
so
can
that
stop doing it.
we can stop doing it too. That's true. And then, I think we learned today we're going to start seeing more about DNA repair and
Yeah.
novel ways to kind of promote DNA repair enzymes intrinsically, which is
Yes.
super
Super
exciting.
interesting.
Yeah.
Yeah. We've been using the same DNA repair enzymes for a long time,
Mhm.
and they're super popular. And I had Dr. Daniel Urosh on the podcast. And for those of you listening who haven't heard that podcast, it's a really good one because, he's really sort of considered the father or the grandfather of that whole movement. DNA repair enzymes, so interesting. But now we're going to kind of tweak it and do it in a little different way. So it's going to be a very interesting evolution, I think.
I think 2026 will be the year of precision. We're going to see a lot more personalized skincare coming
Oh,
out.
yes.
Small companies are already doing it. They just maybe need a little bit more funding to be able to market what they're doing. But
Mm-hmm.
imagine taking a little piece of skin and culturing fibroblasts, and then pushing the fibroblasts to produce growth factors, and then you distill and you concentrate those growth factors and put that into your own personalized skincare cream. So it's your own growth factors that are
Yeah,
concentrated. So there's a company doing that. Mark Rubin has started a company for that, which I think is really interesting.
that's
And
super
then
interesting.
other companies are doing incredible things with personalized skincare
Skincare,
based on your genome, and also epigenetically. And
epigenetics. Yeah.
mhm. And then there's companies that are really just again, focusing so much on the hallmarks of aging. And so you could, at some point with an epigenetic clock, for example, be able to say, I think I need to focus on this hallmark of aging or that hallmark of aging. And there are companies that will be targeting products and ingredients just for that. So we're getting there, folks. We're really getting there where you'll have your own skincare regimen based on your own DNA signature and your epigenetic
Yes.
signature. Much like they're doing in longevity, Patti, where these companies are drawing, you draw blood, you send it to the lab, and they find out what micronutrients you're deficient in, and they develop your own
Yeah, your own
supplement.
supplements. Yeah.
And that is a supplement just for Ted, and
Yeah.
I get to take my own supplement, which I think is pretty cool.
Yeah. And I think we're seeing also similar to the longevity, whole body longevity, things like stacking peptides, skin
Mm-hmm.
peptides. We have so
Mm-hmm.
many good peptides now. So I think we're going to see more evolution in that area. And we know we've got new peptides like microdipeptide, which you and I both talked about before,
Mm-hmm.
which is a really multifaceted peptide, anti-inflammatory, anti-aging, all kinds of interesting benefits.
Yeah.
So stacking for the skin. I like
Stacking
it.
for the skin. Yeah. It
I like
seems
it.
like as we learn more and more about peptides, Patti, you're way more of an expert about this than I am, but it seems like peptides can do much more than we originally thought they could.
You're right about that. And, I'm working on that talk I'm giving at MCAS and looking at collagen peptides.
Mm-hmm.
And, in the wound healing models, those collagen peptides, those fragments of collagen, make those fibroblasts start healing the wound.
Mm-hmm.
They need to be there. Those collagen fragments are part of the initiating event. Because, I keep delving into, how do these collagen hydrolysates that we're taking as supplements really work?
Yeah.
And it really comes down to that more than anything. I think everybody thinks they're a little building block that you're going to be making new collagen with it, but really it's their benefit is that they influence and turn on the fibroblast to start doing everything that it needs to do to heal the wound. They
Gosh.
seem to be the initiating event.
So it's
Prolyl
like a peptide.
hydroxyprolyl.
Yeah.
They're peptides. They're mostly di and tripeptides that are in the wound that signal in the macrophages and to turn on the fibroblasts, and they just start the whole engine roaring. Just so interesting.
And on the medical side, we've got a small peptide coming in for psoriasis. It's a Johnson and Johnson product, and this is interesting because it's an ingestible peptide, right?
I
It's
was
a
just going to say
once a
it's an
day.
oral, right?
It's an
Nice.
oral, and the way that they formulated it and structured the peptide, it's resistant to the gastric enzymes and the acidic pH. So
That's the
peptides are going to
challenge.
yeah,
That's a challenge.
peptides are playing a huge role in dermatology, and they will continue to. So
Yeah.
even though we'll be talking a ton about these different longevity and regenerative ingredients, which won't necessarily be peptides, but overall, you're going to see companies still focused on peptides,
I
and it
agree.
looks like it's crossed over into medical as well.
Mm-hmm. It's
Um,
interesting. Is it a liposomal delivery? How do they stop it
no,
from?
it's like a ring apparently, and because of the shape of the peptide in a ring, it makes it very stable and resistant.
Resistant.
So
Oh,
it's
cool.
not in and of
So it's the
itself.
chemical structure
It's the
itself.
chemical structure. Yeah, it's not
Wow.
within anything that makes it resistant to the enzymes. It's the actual structure of it itself. So super interesting. Yeah,
Yeah, it
that's
really is.
medically that's my other hat, Batty, is medically we're going to see a lot of oral therapies for psoriasis come through in 26 and 27 that are going to rival the efficacy and certainly
Of
the
the
safety of
biologics.
injectables. Mm-hmm.
Good.
And so it's going to be great for our psoriasis patients. And then,
Yes.
I'm going to talk to Matt Zyrus. I think next week we're going to record a podcast episode about what's happening in the atopic dermatitis space, because we're getting new treatments that'll decrease the frequency of injections to every 3 months, maybe every 6 months, and we'll start seeing that
Oh,
injectable for psoriasis as well.
that's going to be
So
fantastic.
yeah, it's just an amazing new future for our inflammatory disease patients.
Yeah, that's a
Super
game
excited about
changer
that.
because those biologics, they're expensive, they're time
Oh yeah.
consuming, and they have side effects.
And
So,
who,
but they're great. They've changed the life of psoriasis patients and atopics for
hmm
sure,
hmm
no question. I mean, we kind of touched on supplements, but I do think in the skincare arena, we're going to see more companies going towards supplements. They have to almost with this huge longevity push. What's in the supplements is going to go on the skin, and what's going on the skin is going in the supplements. So, we see copper GHK, for example. We see NAD, going both ways, topically and orally and even IV. So there's lots of crossover here.
yeah, nitric oxide boosters as well.
Nitric
I think.
oxide boosters. Yep.
Yep.
We saw
We'll
those at
see
the
a lot.
longevity conference. So that's another whole new arena. And another thing that I think is really interesting is a lot of companies, like the menopause, perimenopause thing hit a couple years back, and you and I talked about that on this podcast. But now they're really trying to sync skincare with the hormonal fluctuations and normal hormonal fluctuations. So, for example, there's a company that was not familiar with till I started reading about this that gives you 4 different serums for each of the different phases of your basically menstrual cycle. So you have one serum for the menstrual time, one serum for the luteal phase. So it goes, the follicular phase. Each phase you have a different serum for. So it's sort of
Wow.
trying to sync your skincare with your cycle, and we've seen that with the circadian rhythm products. That
Right.
it's another subject we're going to cover at the summit this year.
Yeah. I wonder when these wearables are going to catch up, when they're going to be able to start testing sweat or measuring body heat and be able to tell us, okay, now it's time for you to use this product or this ingredient and really change by the day what we need to apply to our skin and maybe even the supplement that we need to take as well. You just get the feeling that wearables will eventually get there and really deliver on their promise.
Yeah,
We're kind of scratching the surface of wearables, and we'll talk about that at the summit. We have
I know.
a
I'm
real
looking forward to
expert,
that
mhm,
because I
a
don't
real
know anything
expert
about
on wearables.
wearables.
Yeah, we're going to find out, how to use them, what you do with the data, and so that'll allow us, especially for those of us interested in longevity, and we could have our
Hmm.
patients kind of download their data. We could review it and then give them an idea of what that means. Again, personalized skincare, personalized medicine is where
Yeah,
it's at. And now we've got some of the data to help us with that.
and
So,
we've got also to talk on menopausal hormone therapy.
mhm,
So that'll be really interesting as it relates to skin and the different changes that we see during
yeah,
that time frame. Super
yeah.
interesting.
I think I'm just thinking more broadly because of the Secretary of Health, really focusing on more natural ways to treat disease. He's really into that. We'll probably see a push in skincare to align with that. And I wouldn't be surprised if we see more botanical ingredients coming out, more certainly plant based exosomes. I'm sure we're going to see that.
Oh, for sure.
But otherwise, botanical ingredients to align with that push kind of nationally. And I think a lot of patients want that as well, where they want the clean and sustainable and natural ingredients.
Yeah, they do. And botanicals are so rich and so full of uh, phytoactives that are biologically active in the skin. The polyphenols, for example,
Mm-hmm.
are just phenomenal ingredients.
Mm-hmm.
They're such multitasking ingredients. They absorb UV light, they're antioxidants, they chelate metals, they can stop glycation. I mean, they're incredibly versatile molecules. They do more than that. My brain just can't remember it all.
Yeah.
I've got slides on that because there's so many things that they do. It's unbelievable.
Yep.
And
We learned
that's
that from Carl Thornfeld, right?
we
He
sure
he
did.
he was one of the first movers but for using
He
botanicals
was
in skincare.
way back before anybody was into it. He was into it. I remember him telling me about it. He was so excited, and good for him. He was out on the forefront.
Yeah. So, okay, we talked about everything except cleansing. And I think you and I were just talking, Patty, and you had heard someone talking about triple cleansing. And
Oh,
I I just don't understand that. And where
I
did
don't
that come
either.
from?
They lost me on double cleansing, if you want to know the truth. Like, I'm lucky if I can even wash my face at night because I'm
Yeah.
asleep half the time by the time I even think about it. I don't know where it came from, but I think most women don't wear that much product on their face anymore.
Oh,
I mean,
yeah.
back in the day when you wore foundations, and I mean, like
Mhm.
a lot of that is kind of gone by the wayside. People use
Mhm.
lighter things that are very easy to remove with simple foaming cleansers or even
Mhm.
non-foaming cleansers, whatever you prefer.
Mhm.
So I really don't know where it came from. I think a lot of it came off of social media,
Mm.
honestly. Um, but yeah, you lost me at double cleansing, so forget triple cleansing. That isn't even an option
Okay. Yeah.
for me,
And
and I don't think I would promote it. I've always been a skinimalist. I've never liked complicated skincare regimens. I've never liked complicated cleansing regimens. I think compliance is more important than anything, and the more that you do, the less likely people are to do it. Just like when we give people a bunch of medications, we
yeah.
know that compliance goes down every time you add a new med.
Yeah. I think 2026 may be the year where we see less and less use of retinoids also.
Well, you and I have been talking about that, you know,
Yeah.
with each other for a while. And
Yeah.
I think it's because of this regenerative push. And I
Mhm.
think it's also because I don't think people equate, irritation and those things with benefit anymore. It's like we used to say, oh, I'm not getting peeling, I'm not red, it's not working. But now people understand that you can influence skin on a cellular level without that.
Mhm.
So that's whole notion, I think, has been sort of debunked.
So much focus on the retinoic acid receptors and the retinoic the the way to turn on and off genes using the rare the
Yep.
it's just I don't know that we need that pathway anymore. And so and that
Well, we can
saves
make
our
fibroblasts, activate fibroblasts with a million things,
yeah, and we can
with growth
fix the
factors,
barrier.
with
Right.
certain, with all kinds of things. Yeah, with
Now,
barrier.
certainly if you have acneic skin and you're dealing with acne, this is a wonderful to continue to be foundational for treatments for acne. But in terms of the aesthetic space, I'm really I think you and I have kind of decided that we just don't need them anymore.
And I
With all
love
these
retinoids so
incredible,
much. So
yeah.
I don't want to hurt their feelings because I love them so much. They got us to where we are. And understanding those retinoid pathways was really the beginning of a lot.
Mhm.
So, and we've got new ones like HPR, hydroxypinocolone retinoid, which doesn't even go through all those retinoid pathways. It goes right into the nucleus and binds right to the nuclear receptors. It skips all that other stuff.
Yeah,
You know, it's and it's less irritating.
it's
So we
exactly
have
it.
smarter retinoids now.
Yeah.
I think smart ingredients is really kind of where it's at. Like we're talking about the peptides and think of everything that might be in an exosome. Like smarter ingredients that can really they're like, homing pigeons just going
Hmm.
right to the root cause of what's really making the skin unhealthy.
Hmm.
I think another thing that we maybe should mention is we touched on the barrier, but I still think in 2026, the whole barrier supporting the notion that the microbiome needs to be tendered and not, you know, not messed with, so to speak,
Hmm.
and how all of those things the microbiome plays such an important role in our skin barrier. The barriers really, the microbiome and the barrier are synonymous.
And I think that's why we need the movement away from retinoids in the aesthetic space is really just going to help the barrier and the microbiome as well.
Right. Yeah. That's what made me
Um,
think about it. With less
mhm.
peeling, less of all of those retinoid effects,
Right.
we we can we can keep the barrier healthier.
Yeah.
And those are
And,
things you don't see with peptides and growth factors and things. You don't see those type of side effects.
and then tying back to your supplement discussion, I think we're seeing a lot more supplements come in and talk about how they can affect the barrier as well.
Oh yeah.
And
Yeah, yeah, yeah.
much like the injectables, in the medical space, we know that the biologics for atopic dermatitis repair the barrier. There's data to show that.
I
And
know. It's
so,
phenomenal, isn't it?
yeah, we can repair the barrier from the inside. And we can do that with some of these supplements. And so we'll see, for those who are having sensitive skin syndrome or cosmetic intolerance syndrome, the
Yes.
supplements are going to start playing a bigger and bigger role. I mean, there were early movers in the supplement space, and I think they're finally going to see their time to shine in
Yes.
2026 as we focus on that. I'm
So many of the
certainly,
big companies are looking into supplements now.
yeah,
So many of the majors,
yep, yep.
which is great. I think
I,
one other thing we should just mention that's really become such a big trend in the skincare industry is this teenage skincare
oh yeah,
craze, the preteens and the teens. And, I kind of straddle the fence on it, quite honestly, because I think, rather than try to, police it or stop it, I think using it as a teaching opportunity to teach kids really what is important and maybe what they shouldn't be doing. We could use it as a launching pad to just like we teach little kids how to brush their teeth and floss. If we could teach them how to use sunscreen and what moisturizers are good for kids with acneiform skin or acne prone skin, I think we can use it as a teaching moment. We're all familiar with the kids who get irritated by using anti-aging regimens. I mean, all that needs to be flushed out. But I think that's another good place for the dermatologist to interface with the acne patient in the office, talk a little bit about skincare,
yeah,
and kind of set the guidelines, put the barriers up on what's acceptable and what's not acceptable so that they don't get what we're calling now the digital dermatosis, where they're getting irritated by who knows what they're putting on their face. We've all seen that too many times. So I think that that's a good opportunity for maybe our skin dermfluencers to really go out there and teach the kids who are listening.
Yeah. In the end, and I think every time I'm asked, please educate on skincare, what's the best, product to use, or how would you deal with this issue in the media or whatever, I feel I tend to always kind of, at the end, I always say, and then visit your dermatologist, because it's really difficult for someone that doesn't have the education in the skin to develop the kind of regimen that your skin needs.
Right.
And it changes over time as we've been discussing for the last 30 minutes. So I do think that we just, as dermatologists, need to be prepared for our patients to come in asking these questions on skincare, because it's becoming so much more important to our patients, especially in the longevity aspect of skincare. So, I think our colleagues we all just need to be prepared for that, and make sure that we're meeting our patients' needs in that respect. I know it's super easy just to focus on the acne and the eczema and the psoriasis, but when they do ask about, skincare regimen, it means just as much to them as curing their eczema.
Yeah. And maybe more, depending on who it is. I always love to quote Ruth Tedaldi, you got to be the genius bar of skincare.
Yeah.
And that it's really good, because that's really who we should be. And it's such an important part of what our patients want to get from us.
Yeah.
And if they don't get it from us, they'll get it from somebody else.
Yeah, the digital dermatosis.
the digital diagnosis causing digital dermatosis.
Yeah. I always learn something with you. Oh my gosh.
Because I stalk social media, because I just am totally fascinated by it.
You stalk it, I avoid it. It's a perfect combination. Well, folks,
all right,
we did it.
We're going to wrap it. We are going to wrap it.
You got through 2026 tips and trends. We're hoping that's what we actually see. I think that we may be right in maybe 50% of the cases.
Just put the beef tallow away. That's all we're
please.
asking. That's all we're asking. One simple ask.
Yeah. All right. Well, listen, I'm Ted Lain, my partner, Patti Farris. Thank you so much for listening. Of course, we always appreciate our listeners. If you like today's episode and you like the podcast in general, we really appreciate word of mouth. So please tell your colleagues. We found that the growth of the podcast really is due to the wonderful word of mouth referrals that we're getting. So we so appreciate that. You can always learn more about what we're doing. scienceofskinsummit.com is our educational platform. We are going to be doing a lot more podcasting this year. You'll see us dropping episodes every year every week.
Every week.
And we'll be doing a lot more on the medical side. And so we're going to be kind of covering the gamut of dermatology now with the Science of Skin podcast, and we'll be a lot more active with the webinars too. So stay tuned, folks. We really appreciate you joining us. And here's to a great 2026. Happy, healthy to everybody. Thank you so much.